Pass and vote on the following items of business: the nomination of Lisa Gomez to be Assistant Secretary for the Employee Benefits Security Administration at the Department of Labor, the nomination of James Rodriguez to be Assistant Secretary for Veterans Employment and Training at the Department of Labor, the nomination of Dr. Maria Rosario Jackson to be Chair of the National Endowment for the Arts, nomination of Shelley Lowe to be Chair of the National Endowment for the Humanities, and the nomination of Susan Harthill to be a member of the Occupational Safety and Health Review Commission. The Office of Government Ethics has reviewed all of the nominees' credentials and found they are in compliance with applicable laws and regulations governing conflicts of interest. These are qualified nominees who are committed to serving workers, veterans, retirees, and families across the nation. I'm proud to support their confirmation and hope all of my colleagues would join me in voting them out of committee today. We will start with a roll call vote on Lisa Gomez's nomination, and then we will voice vote the remaining 4 nominees en bloc. I intend to move these votes promptly at 10:15. If there's anyone who wants to speak, I am happy to stay after until everyone who wishes to speak has done so. Senator Byrd, do you have any opening remarks?
Madam Chairman, thank you for this markup, and I'll have comments for the record on the nominations before us today. Some I support and some I strongly oppose. But what I'd like to do is turn attention to the child care and preschool proposals in the reconciliation bill the House sent over to us. In 1990, before any of us were serving on this committee or were in Congress, President George H.W. Bush and the Democrat majority passed the bipartisan child care and development block grants to help families afford child care and preschool for their children. It's been a resounding and bipartisan success that members on both sides of the aisle proudly support. 12 million children each year rely on a non-parental care while their parents work or get education and job training so that they can eventually work and support their families. Parents need affordable, safe, and reliable child care and preschool education. We all agree on that. We Republicans have asked for hearings and a markup on the proposal that puts Washington at the center of every decision a family makes about child care and preschool in every state, county, city, and local community. We've not been given that chance. So here are 4 things I want everyone in the country to understand about these proposals, which I consider to be destructive to the child care industry. 1, faith-based or religious providers will close, as will small family child care homes and kinship care settings. 52% of child care in America is in faith-based organizations today. 2, child care and preschool costs will rise dramatically. 3, states will be burdened with huge costs and aggressive federal government control. 4, this entire proposal is built on a series of budget gimmicks to hide the cost to the American taxpayer until it's too late. I'm going to go through all 4 points. The proposal before us ends the ability of faith-based and religious providers to participate in child care and preschool. First, it overrides the 30-year bipartisan agreement, an agreement crafted by this very committee, passed by bipartisan majorities, and one which has stood the test of time, that allows faith-based providers to participate in these programs without compromising their religious mission and directly applying federal civil rights laws on all participants. Second, it calls the new funding direct financial assistance to providers, further undermining religious providers' ability to participate in these programs. Third, this bill makes the funds grants and contracts instead of certificates, as the law has done for 30 years, further intertwining funds for families with government rules. These proposals make faith-based providers choose between God and mammon, that is, between their faith and federal spending. In Matthew chapter 6, verse 24, it says, "No man can serve 2 masters." My father was a Presbyterian minister. I can remember when we moved to North Carolina for the first time, and he accepted the downtown First Presbyterian Church. Before that, he was in Charlottesville and Norfolk, Tim. And I remember one of the first things he did at that church was he put that downtown church in the child care business. And when asked by the Board of Deacons why he was so passionate about this, he said, the church must lead in making sure that the next generation is nurtured in the right way. and we should set the example. The House bill intentionally and deliberately sets out to destroy the ability of faith-based providers to participate. The Senate will have a choice whether it will follow that path. Second, child care and preschool costs will rise dramatically. Let's start with the cost estimation models that must be approved by HHS bureaucrats in Washington who think everything looks like the city they live in and who have not once operated a child care program or been responsible for running a program, especially one that operates on an average 1% margin. Next, the living wage, also determined by Washington bureaucrats. Will they allow geographic diversity? Will cities have different rates than rural and suburban areas? The California model of driving up cost at every opportunity is all the Secretary knows. And the bill intentionally shrinks the supply of providers by killing off the faith-based providers, small child care homes, and kinship care, so the laws of economics dictate that prices skyrocket. The People's Policy Project, a liberal and progressive group, estimates that unsubsidized families will pay $13,000 more per year for their child care. This is a child care tax, plain and simple. Steady or increasing demand will shrink supply, results in dramatic price spikes. That's Economics 101. Some have called this cost disease socialism, where government dramatically drives up the cost of a program, then imperfectly subsidizes the cost for some. The cost of the federal government skyrockets, the subsidized then demand access to subsidies to afford the massive government-induced inflation in cost, and the cycle repeats. Third, states will be burdened with huge cost and aggressive federal government control. The child care entitlement has a 5% state match requirement for this new uncapped entitlement. A 5% state match that may not sound all that high to some. Your governors and legislatures will probably disagree. And states have to serve people making up to 250% of the state median income, which can be as high as $300,000 a year. CBO can't tell us what those matching costs to the states are. CRS can't tell us what those matching costs to the states are. I haven't seen any formula run from the House, and I guess you have to pass the bill to find out what it costs. The preschool program waives free money in front of the states and then grows over time to a 37% state match. It's a lot of money, especially when you don't get to set the rules. Even worse, if a state says they don't want to participate, they aren't given a choice. The Secretary can go around the governors and legislatures and give the money and rules to local providers. And if states do participate, they lose control of their standards, teacher qualifications, accountability systems, cost, and eligibility. West Virginia wouldn't be able to say that you have to actually be a West Virginian to get services. North Carolina wouldn't be able to say you have to be here legally in this country to get services. Washington sets the rules, period, end of sentence. You know what program no state has opted out of? The Bipartisan Child Care and Development Block Grant. I guess putting more money into CCDBG, which during the pandemic has shown to be the right federal and state architecture to best serve children and families, makes too much sense. Finally, this entire proposal is built on a series of budget gimmicks to hide the cost to the American taxpayer until it's too late. The program both end funding in 6 years. I know that saves money on the CBO score, but frankly, it's just dishonest. Both programs also ramp up their cost over time to hide the cost of the program, getting the most expensive just as they turn it off. That's not responsible program design. It's not honest accounting to the taxpayers. It's artful dodging in hopes that the Finance Committee and state legislators will come to the rescue with new taxes 6 years from now to save the program. There's a better way, and I hope that all of my colleagues and my friends on the other side of the aisle will join Senator Scott and follow his advice. We need to empower parents and not government. We need to help families afford child care and preschool, not make it more expensive. We need to raise up our faith-based organizations, child care homes, kinship care, not make them the enemy. It's not too late. We can restore the bipartisan conversation on child care. We can work together and expand on the work we've done for the past 3 decades together. It just doesn't have to be this way. I thank the chair. I yield back.
Thank you, Senator Burr. We are here today to approve 5 nominees. I have committed to my members that we will vote by 10:15. I am happy to rebut much of what you just heard, and will do so. I do want to say one thing, and that is religious providers are absolutely eligible for this program, like every other provider, and the bill text specifically says that. I have a number of other comments I could make in response, but I will not do that at this time because I have made a commitment to move to this. I will stay after we vote for any other senator who does wish to comment. So we will now move to the first order of business today. To approve the nomination of Ms. Gomez to be Assistant Secretary for the Employee Benefits Security Administration at the Department of Labor. Seeing that a quorum is present as required by the committee rules and the standing rules of the Senate, I now move to favorably report the nomination of Ms. Gomez to serve as Assistant Secretary for the Employee Benefits Security Administration at the Department of Labor, and the clerk will call the roll.
Senator Sanders? Aye. Senator Casey? Aye. Senator Baldwin? Aye. Senator Murphy? Aye. Senator Kane?
Aye.
Senator Hassan? Aye. Senator Smith? Aye. Senator Rosen? Aye. Senator Lujan? Aye. Senator Hickenlooper? Aye. Senator Burr?
Votes no.
Senator Paul?
No by proxy.
Senator Collins?
No.
Senator Cassidy?
No by proxy.
Senator Murkowski?
Aye by proxy.
Senator Braun? No. Senator Marshall?
No by proxy.
Senator Scott?
No by proxy.
Senator Romney?
No by proxy.
Senator Tuberville? Senator Moran?
No by proxy.
Chair Murray?
Aye.
I have 12 ayes, 10 nays.
The ayes have it. The nomination is agreed to. It will be favorably reported. Our next order of business today is to approve the following 4 nominations. The nomination of James Rodriguez to be Assistant Secretary for Veterans Employment and Training at the Department of Labor. The nomination of Dr. Maria Rosario Jackson to be Chair of the National Endowment for the Arts. The nomination of Shelley Lowe to be Chair of the National Endowment for the Humanities, and the nomination of Susan Harthill to be a member of the Occupational Safety and Health Review Commission. Seeing that a quorum is present, as required by the committee rules and the standing rules of the Senate, I now move to favorably report these nominations. All those in favor say aye.
Aye.
Opposed, nay. Ayes have it. The nomination will be favorably reported. I would also like to ask unanimous consent to enter into the record 1 letter in support of Ms. Gomez's confirmation, so ordered. Is there any other senator who wishes to be recognized? Seeing none, that concludes our business today. The committee will stand adjourned.